And with that, we'll move on to Odd, our next panelist, who will be giving us an overview about health taxes and how fossil fuel taxes can and should be considered health taxes, and the conversation on challenges on implementing reforms on these taxes. Over to you, Odd. Thank you.
Thank you so much. Before I get started, I just want to say that as I picked the background, I would be much more comfortable if I could be the one talking about numbers, but we passed over to Lourdes to lead us through the graphs and the numbers side. So I'll instead try to talk about more the theory or the motivation behind this idea. So Jordan gave us a quick introduction earlier on what health taxes are. So in general, in a quick summary, a health tax is something that is an additional cost on the sale of goods that have a negative impact, particularly on people's health. Now, the idea is that if you raise the price of something, someone is going to be susceptible to that increase in price and consume less of it or not consume it at all. So by changing the price mechanism, by changing the price of something, we're changing people's behaviors and therefore changing their health as well. Now, another side to health taxes are that they raise revenues for the government to use. And as a result, the government having more revenues allows them to then spend more on health. So indirectly, a health tax also contributes to more health spending and therefore also improves health outcomes. More often than not, health taxes are what are known as excise taxes, meaning that they're levied or they're made to be paid on the product when it's either brought into a country or when it's produced. And the biggest sort of health taxes in the world are on tobacco, alcohol, sugar-sweetened beverage taxes, and in a few countries also on saturated fats and trans fats, or ultra-processed foods or meat particularly. Another sort of important aspect on taxes has to do with how they're raised. So a World Bank report noted that it's easier to raise or to gather excise taxes than it is to raise or pick up income taxes or value-added tax. So instead of collecting something on its sale, it's then levied on its purchase. And so even when we think about the ones that are easy to collect, being income taxes or VAT, the general consensus is that this kind of tax is even easier to raise or to collect by the government. And linking to sort of the wider health sphere of what interventions are good or not, health taxes are known as being cost effective, particularly cost effective, which means that they have a big impact on improving people's health, but don't cost much more to governments themselves to implement. You can either choose to prevent, say, lung cancers or cardiovascular disease that Barack mentioned earlier, which don't cost much money through this, like imposing taxes, or you can choose to treat them, which then afterwards have a much lower impact on people's health, but also cost much more, and so therefore have a much lower cost effectiveness. So health taxes in themselves are accepted as a very cost-effective intervention. Now, fossil fuel taxes generally have a slightly different motivation in most places. They're implemented generally because of their impact on the environment. Countries put taxes on fuels and combustion of fuels because it contributes to having cleaner air. And many other places, they are sort of a bedrock of a source of financing for governments. Now, the idea, as I sort of talked about a little bit before, was if you have higher prices, both producers and consumers will start to consider alternatives. And the idea is either through producers changing priorities or consumers changing priorities, you'll end up seeing an impact on the 8 million approximate deaths a year from air pollution. And also, as Barack mentioned, since the burning of fossil fuels are the main driver of climate change, if we implement more taxes on fossil fuels, you're also going to have a positive health impact through the smaller impact of the size of climate change that happens in the future. Now, perhaps the most interesting bit, in my opinion, is if these things are so great, why is it that there isn't high taxes on fossil fuels everywhere? So like health taxes, there are some sort of standard challenges to implementation. And the first, which we can draw from thinking about tobacco and alcohol, is that the industries behind these products are particularly powerful. They have strong influence through lobbying and also through consumers themselves. Tobacco, alcohol advertisements have a sort of created a strong consumer base, and that therefore will have some opposition to having to pay more for their prices. And similarly, the same industry, but others maybe from outside, will sort of say that there are reasons why we shouldn't have these taxes, that these impact more certain people than others, that maybe are already kind of poorly off, and that perhaps by putting taxes, the consumption will then shift either to other places where there isn't taxes, or lead to people to what's called engage in illicit trade. So buying things illegally where the taxes are not imposed on them or they're not taken up. And generally talking about sort of raising public opinion against them, because no one really likes paying taxes. And it's especially when the case is that you don't know what these taxes are going to go for. If you'll say, why should we pay more taxes if we're not sure that they're not just going to go into a politician's pocket? So these are sort of what health taxes in general have always had challenges or opposition to in implementation, and they apply to fossil fuels as well. However, there are a few things that are unusual about fossil fuels. First off, there is no other area that has a subsidy as opposed to a tax. So countries already have created a relationship with people that people sort of expect to have a right to consume fossil fuels below the price that the market would set it as. And so you are talking about creating a change in this relationship that people have with this product that they have developed over time. Like the other sectors, there's a lot of power and influence within the industry, with the fossil fuel industry. So if you think about the power of tobacco, just think about how much more power the fossil fuel industry will have. But very uniquely, fossil fuels themselves are not just something that people consume. They are also something that goes into the other things that are being made, or other services or other jobs that people do. So it isn't just alcohol that's consumed, but fuel that then goes into a factory that is used to make other things, or fuel that goes into a car for people who drive cars or trucks for a living. So the people affected by this are for their livelihoods are much more. And then similarly, everyone practically consumes fossil fuels. So a tax affects everyone. You can sort of think of the taxes on tobacco. Most people that are not smokers don't think about it because it doesn't affect them, but practically everyone is going to be affected by a fossil fuel tax. So the sort of the opposition then is much wider, much broader than with some of the other health taxes. So the idea is to bring this about, we really need to change the discussion about fossil fuel taxes or cutting subsidies as something that is done not just for the environment, which is good in itself, but for the value of health, for improving everyone's health. And that these messages of them being regressive are only on who pays. But the truth most often of the time is that subsidies are actually regressive themselves. The more well-off tend to benefit more from subsidies. And then the outcomes in terms of who benefits from the health improvements and who benefits from government spending that comes from money raised from fossil fuels is progressive rather than regressive. And the idea that it really needs to help make this a viable idea or viable interpretation is to sell the idea that the taxes are not just being raised to go into government coffers, but we will raise taxes which will improve your health. And those taxes themselves will then also go into improving your health through more spending on healthcare. And then finally, as with any tax or with any measure, there's going to be some people that are being made worse off than they were before. And to help sort of transition and make this sort of more viable, there's an important consideration to having some kind of mechanisms, temporary mechanisms, to help support and compensate those that have been most impacted by these new reforms. With that, I'll wrap up and pass the word back.